από όσα ήταν. Είμαστε στην Αμερική με τον συνάδελφο, τον πρόεδρο τον Κώστα τον Μαυρέλο, που ήταν στο προηγούμενο Προεδρείο, και είχαμε πάει σε ένα συνέδριο ενδοσκοπικής χειρουργικής. Και μας έκανε τρομερή εντύπωση ότι το μισό σχεδόν συνέδριο, η έκθεση του συνεδρίου, η μισή ήταν αφιερωμένη στην αισθητική γυναικολογία. Και λέγαμε, πού πάει το πράγμα, 15 χρόνια πριν, μας φαίνονταν λίγο τραβηγμένο. Η Ελλάδα ακολουθεί με μια διαφορά 10 χρόνων και αρχίζει τώρα να ανατέλει και το θέμα της αισθητικής γυναικολογίας και στην Ελλάδα. Και ο Αλέξανδρος ο Μορτάκης, όπως πάντα, είναι πάντα μπροστά. Και σε μια συζήτηση που είχαμε τότε που στηνόταν η Εταιρεια, μου λέει θα πρέπει να βάλουμε και την αισθητική γυναικολογία μέσα. Και βεβαίως θα τη βάλουμε με μια χαρά και προχώρησε αυτό το θέμα. Και σήμερα είμαστε εδώ, συζητάμε όλα αυτά τα θέματα που έχουν άπτονται της σεξουαλικής δραστηριότητας και της αισθητικής. Και έχει μπει μέσα στο πνεύμα και η τεχνολογία, η οποία βοηθάει πάρα πολύ στην εξέλιξη όλων αυτών των πραγμάτων που κάνουμε και των επιτευγμάτων που τελικά επιτυχαίνουμε στα θέματα δυσλειτουργίας ή ακόμα και την αισθητική και την ομορφιά που δεν έχει πλέον χαμηλή αξία. Έχει μεγάλη αξία για όλους μας, και για τις γυναίκες αλλά και για τους άντρες. Σε αυτή τη συνεδρία θα συζητήσουμε και για ουρογυναικολογία και για αισθητική. Ο πρώτος ομιλητής είναι ο κύριος Γκόλντ από το Ισραήλ, ο οποίος ασχολείται με την εφαρμογή του λέιζερ στην ουρογυναικολογία. I invite you to the point. Podium.
Kalimera. It's a great pleasure to be here in Athens and to talk about laser and how can we help our patients. And the topic was New Frontier, but as I saw the program, I saw that there are many talks about lasers, so it's not just a New Frontier, it's an area that everybody is speaking around urogynecology, gynecology, dermatology, and as you can see, there are sessions here that dealt and will be dealing with laser. But nevertheless, people that I spoke around here are very skeptic about it, and I want in my talk to show that it's work for you and for your patients. And even if you haven't tried or heard, don't be reluctant and jump to the water and start do it. As we know, there are 5 phases of change, and it depends on the cultural setting and the doctor's knowledge. But I believe that we can change the situation and go up to the phase of adoption and learning instead of the resistance and depression that we are around the world right now. So my talk will discuss about the indications and demand for the laser, the technology itself, the procedure, the clinical effect and results, clinical studies, about the system that I believe in, and the benefits that your patients and you will gain. So what are the indications and the demand from the market and from the doctors? We are talking about vaginal tightening, stress urinary incontinence, vaginal dryness, post-delivery rehabilitation, genitourinary syndrome of menopause, recurrent vaginal infections, vulvar rejuvenation, scars, vulvodynia, vestibulitis, lichen sclerosis, and bleaching of the vulvar area. These are all can be dealt with the laser machine. Regarding the problems that we are dealing, we all know about the genitourinary syndrome of menopause. It's a collection of symptoms and signs associated with decreased estrogen and other sex steroids, and create symptoms of dryness, burning, irritation, lack of lubrication, discomfort and pain during sexual intercourse, as well as urinary symptoms. This is the new terminology since 2014. And you can see how it affects the life of your patients. And we know it's an increasing problem because as the population gets old, more patients will be during the menopause, and most of them will suffer from one or more symptoms of GSM, so we need to treat them. And until now, we had some lubricants, local estrogen replacement therapy, and the patients were not happy about it, and they were looking for something new. As well as stress urinary incontinence, it's also a great problem, and we know it involves leaking of urine when increased intra-abdominal pressure like coughing, sneezing, jumping, sexual intercourse. And we know at least 30% of the women suffer from urinary incontinence. I say at least because it's the tip of the iceberg. Most of the patients don't tell us about this problem, and at least half of them suffer from stress urinary incontinence, and you can see the demand. Procter & Gamble sells $7 billion of absorbent pads for adults, and it's growing 7% annually. And in study from the States, patients are willing to spend more than $1,400 per year just to be cured from stress urinary incontinence. So you can see the demand. And until now, we have treatments like pelvic floor exercise, electrical stimulation, implants, medication that were used but not now, and surgery. And regarding surgery, there is a great problem right now with the mid-urethral slings. We have the FDA warning about the slings. We have now the NICE in England warning about the slings. We have huge amount of lawsuits with the slings, so we need to start to look for something new. We have also problem of lichen sclerosus. It's a chronic inflammatory dermatosis involving the vulva and perianal skin. And it occurs at any age, but the incidence range above the 40, 50 years old patients. We don't know the exact etiology, and since then, we don't know exactly how to treat it. And it's very bothering symptoms, and sometimes the doctors don't know what to do. Another aspect that we are dealing with the laser is vulvodynia, or vulvar vestibulitis syndrome. It's also one of the most common causes of genital pain and pains during sexual intercourse. It's characterized by severe pain on the vestibular touch or attempt vaginal entry. And also here, we don't know the exact etiology, and we have many treatments, but none of them are working. So what can we offer to all of these patients that are looking for therapy and something new? We can offer them the laser. So laser in the field of medicine was introduced in 1973 in Israel. You can see Dr. Isaac Kaplan was the first one to introduce laser into clinical surgery and into treating erosion of the cervix with laser. It was 1973, but since then the shift was toward the dermatologist and plastic surgeon doing facial rejuvenation, photothermolysis, and only in the recent years it came back to the gynecologist in treating all of the symptoms that I've discussed earlier. So how does the laser affect? It has a multiple effect. It released nitric oxide, it increased ATP production, it increased creation of new fibroblasts, new blood vessel, enhance building new collagen. So have multiple effects of the laser. And I don't know about you, but many of my patients, when they come and they ask for treatment, and they said, is it involved with laser? Because the concept by the public that laser is the cutting edge technology. And we have to be able to offer them also the laser because it's the demand. And we can do with laser remodeling of the tissue of the vulva and the vagina, all of that with the laser. And there are a number of advantages that you need to know and the public should know. It's a non-invasive procedure. Basically, it's an office procedure, coffee break procedure. It takes only 10, 15 minutes. The patient comes, get into the examination chair, we do the treatment, and she goes back to her normal life. It's easy and safe procedure, minimal discomfort and pain. It's effective with rapid healing. And I advocate use of single-use hygienic vaginal probe instead of re-sterilization or other probes that are not single-use. So basically, I will talk about the CO2 laser because that's one I believe in too. CO2 laser stimulates production of collagen, elastin, and vaginal fibroblast activity, as we talked. It causes long-term effect with microablative effect, and thus we can enhance and treat all of those problems as we talk. Why not to choose other lasers, like the erbium? Erbium is highly absorbed in water, and therefore the thermal injury is much lower than with the CO2. And if we want to achieve thermal effect that will cure the patient, we need to choose a modality that won't be absorbed by water. As you can see, the difference between the pixel CO2, the scanner CO2, and the erbium laser, you can see that the pixel CO2 enable us to get a deeper thermal effect into deeper tissue, and by that we can create a greater thermal effect and more success rate. Again, comparative between the ablative resurfacing, either by CO2 or erbium YAG, superficial fractional ablative resurfacing, and the ablative and non-ablative CO2 laser, and you can see that the penetration of the CO2 laser is much deeper into the deeper tissue, and that's what we want to see. Also, we want to remember that the temperature that we want to achieve is below 57 degrees, because this is the reversible damage occurs there and can produce the rejuvenation. We don't reach above that because it will cause either reversible damage or carbonization. And by doing the microablative system, we can enhance those temperature and reach them easily. How does the pixel CO2 works? The fractional laser creates through holographic lenses beam of from one beam, 81 microscopic beams, that's the pixels, and cause ablation of the mucosa by microscopic columns, and stimulates the growth of collagen and remodeling. As you can see, there's a one beam that's split in the lens to 81 microscopic beams, and enable us to reach a higher level of energy, to deeper tissue, with short, easy, and efficient treatment. As you can see it on a paper, this is the same 81 holes by the pixel CO2, and that's how it looks in real life. This is a colposcopic picture of a vagina after treating with a pixelated CO2 laser. You can see the healthy tissue between the columns of the lasers, and it enables us to have rapid healing without any carbonization or any damage to the vagina as a whole organ. And you can see the rapid healing just immediate after the treatment, and below 2 weeks after the treatment, complete healing of the vagina, no signs of the treatment. I believe, as I told, in pixelating CO2 and not scanning, because by that it enables us to reach much deeper with higher energy. As you can see, the comparison between the CO2 laser and the scanner laser, with the same amount of time, we can deliver much higher levels of energy with pixelating the beams other than by scanning the tissue. By saying that, I must deliver some data, otherwise you won't believe us. So, as Dr. Edward Deming said, without that you're just another person with an opinion, so I will share with you this, some of the data. You can see histology here from just after the ablative effect in A, B, the filling and vaporous space as the column shapes, and then 72 to 96 hour progress of the healing, and then 40 days, and then 4 weeks after the treatment, you can see the rapid healing and the change in the epithelium. You can see here the collagen regrowth 6 months post-family leaf treatment, and other histology that shows you the improvement after treatment with pixelated CO2. We know by the histology the mechanism of action as well. We know that within the 48 to 72 first hours, we have early thermal effect, we have edema, and that's why many of the patients come and tell that after the first day they felt a huge change, but after 1 week it passed. And it's involved also with release of chemical mediator, shrinkage of collagen and elastic fibers. The second phase following 30 days after the treatment involves proliferation of fibroblast, new extracellular matrix, and collagen fibers. And the last phase, which is the most important to us, is the remodeling of the tissues. And we have mature collagen fibers, we have increased of collagen fiber strain, new vascularization of blood vessels, new blood vessels formation, and improved by that the lubrication and pH of the vagina. We can see a lot of studies that were done about histological changes after the CO2 laser, and again, we can see neocollagenesis and restoration of normal healthy architecture of the collagen after the CO2 lasers. We can see that there is great satisfaction from patients, and again, you can see creating new healthy vagina, new blood vessels, as you can see here. The new blood vessels created, thicker mucosa with healthy cells. You can see cells in postmenopausal women. You can see down the arrows of creating new cells that are activated, activation of the fibroblast as well. And by that, you can see the rise in the literature of publication regarding the laser. We've seen a surge of publication in the recent years regarding laser because of this promising technology. And because it's promising, many companies enter this field because they believe, as I believe, that this is the future. But not all of them are the same. And I want to quote recent 3 reviews that were released in the last months. One of them by Etαιρεια, which also a pioneer in introducing laser and endoscopy in gynecology, and I have a great pleasure to know him. And he published a review of light and energy-based therapeutics for genitourinary syndrome of menopause, consensus and controversies. The second one is laser therapy for genitourinary syndrome of menopause, a systemic review and meta-analysis. And the last one, systemic review of vaginal laser therapy for treating stress incontinence. So we start. The first one by Etαιρεια involved 18 experts from all around the world, and all of them agreed that laser works for GSM with no side effects. They agreed not to agree if it's CO2 or erbium YAG, ablative, not ablative, as you can see. Papers that didn't accept because latency, it's involved laser for breast cancer survivors, and you can see much improvement. Another one shows that increased insatisfaction concerning introital pain, dryness, dyspareunia, itching and burning. Note of them that the itching and burning not only vulvar and vaginal, but also anal, clitoral, and perineal. Again, a meta-analysis also saw the conclusion that the laser therapy for GSM appears promising, and it reduced symptom severity, improved quality of life, and restored vaginal mucosa to premenopausal status. And you can see all of them. Regarding stress incontinence, the results are less clear. The results show promising, but the methodological quality of those studies were quite low, and so we need further studies to show them. I want to show you studies that I've done, and I presented in ICS in Tokyo 2016 about patients. To cut it short, I showed that there is 73–75% improvement in stress incontinence and vaginal lubrication. Another study that I was involved, 100 patients from 3 centers, and it shows also 70% reduced in stress urinary incontinence patients and dramatic decrease in use of pads per day. Another topics that I want to address shortly, vaginal fractional laser is effective for overactive bladder symptoms. It's one study, and I believe it also has a promising field as well. It affects the flora of the postmenopausal women. It increased the lactobacillus and normal flora significantly. Regarding vulvodynia as well, I treat patients with vulvodynia with great success, localized vulvodynia with the CO2 lasers. It's promising. So to summarize, you have advantages of non-invasive procedure, office procedure, easy and safe procedure, minimal discomfort and pain, rapid healing. That's all of the laser are giving. But if you want to be effective in single-use hygienic vaginal probe, I advocate the CO2 Femilift laser. You can see the single-use hygienic probe is very important. You don't need to sterilize. You have a specific mirror lens that prevents from entering the secretion into the probe, and that's prevent. And also, it's multi-package, multi-modality. You can treat with the same machine with different probes. You have the Femilift usual probe, you have the slim probe for atrophic and very narrow vaginas, you have the smart probe that rotates automatically, you have the Femitite, the light scan, and also a camera, the Femitite rejuvenation, the labia majora. You can see before and after treatment with the Femitite. You can see huge improvement. And also you can do rejuvenation of the labia. This is a picture that I've taken from a patient. You can see resurfacing with the light scan. So with the same machine, you can deal with a lot of aspects of your patients. As you can see, vaginal tightening, stress urinary incontinence, vaginal dryness. The most promising subgroup that I encourage is post-delivery rehabilitation with dryness and laxity of the vagina, GSM, vaginal infection, rejuvenation, scar. You can see the whole list that you can treat with one machine. But again, you are the important person. You have to choose the right tool for the right patient. And if you won't choose the right tool for the right patient, you won't achieve any success rate. That's my belief. And also, I want to mention that you can use the laser if you're dealing with gynecology for warts, cervix conditions, dermatology, plastic surgery, otolaryngology, and other fields with the same CO2 laser. So be the one who makes things happen and don't resist technology. Thank you.
Thank you, Dr.